Hi, today I want to talk to you about a couple of things. One, what is joint hypermobility? Two, what are hypermobility disorders? And three, what are the different types of joint hypermobility? So first of all, what is joint hypermobility? Well, joint hypermobility means that a joint has a greater than average range of motion. It is a descriptor, not a diagnosis, and it can apply to one or more joints. Two, what are the different types of joint hypermobility? They are localized joint hypermobility, which is when there's maybe one or two joints that are hypermobile. There's peripheral joint hypermobility, which means that it's limited to the hands and the feet. And then there's generalized joint hypermobility, which means that there's multiple joints that are hypermobile. Then next, I would like to explain what hypermobility disorders are. Hypermobility disorders is an umbrella term that can be used to describe any condition that is associated with joint hypermobility and a person has symptoms. So this is a very broad category and includes many, many different types of conditions, including the Ehlers-Danlos syndromes, osteogenesis imperfecta, Lewy-Dietz, and the newer classification in 2017, hypermobility spectrum disorders. In 2017, the International Consortium on Ehlers-Danlos syndromes and related disorders tightened up the criteria for hypermobile Ehlers-Danlos syndrome because we need to really figure out what is the genetic cause of hypermobile Ehlers-Danlos syndrome. In order to do that, they made a much more strict set of criteria for hypermobile Ehlers-Danlos syndrome. People who no longer fit into that criteria are now diagnosed as having hypermobility spectrum disorder. So that is one of the types of hypermobility disorders. So again, joint hypermobility means that a joint has greater than average range of motion. Hypermobility disorders means that a person has at least one or could be more joints that have greater than average range of motion, and they have symptoms associated with that joint hypermobility. There are literally hundreds of different conditions that fall under this large umbrella of hypermobility disorders. And lastly, the different types of joint hypermobility are, number one, localized joint hypermobility, meaning that you have hypermobility in one or two joints, and that's all. If you have peripheral joint hypermobility, that means you have hypermobility in your hands and your feet. If you have generalized joint hypermobility, then that means that you have hypermobility in multiple joints. I hope you found this helpful. Please visit our website, hypermobilitymd.com and bendybodies.org for more information.